Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to a new episode of Health from Huda TV. Today we're talking about hypertension. I know that most of our viewers, if not all of them, are familiar with the word hypertension. But today we are talking about the problem, and of course, most of us, even if they know that the hypertension means the raised blood pressure, but I believe most of our viewers don't know actually what blood pressure is. So with us today is Dr. Ahmed Abdel Salam, professor and consultant of cardiology at Ain Shams University in Cairo, Egypt, to talk to us about what is hypertension and what is blood pressure. Dr. Ahmed, thank you very much for coming today.
You are welcome, sir.
Hypertension, the problem that most people either have or afraid to have, and most of us know that hypertension is the raised blood pressure, but the very basic, which is what is blood pressure, that is something that most people unfortunately don't know about.
Yeah.
So what is blood pressure?
Okay. This is an interesting subject to speak about, which is what is blood pressure.
Yes.
At first, you have to know that heart is formed of 4 chambers, which are 2 atria, the right atrium and the left atrium, and 2 ventricles, which are the right ventricle and the left ventricle.
Mm-hmm.
Between each atria and ventricle, there is what is known as valve. Yes. Between the left atrium and right atrium, there is a valve which is known as the bicuspid valve or bileaflet valves. And between the right atrium and the right ventricle, there is another valve which is known as the trileaflet valve.
Yes.
There is also 2 other valves which is present between the left ventricle and the artery which it fills blood with. So between the left ventricle and the aorta, there is a valve which is known as the aortic valve.
Yes.
These valves is designed by Allah to pass the blood in unidirectional form, in one direction.
Just one way.
Yeah, it's one way from the right atrium or or left atrium to the right ventricle or the left ventricle.
Yes.
Then the blood is pumped from each ventricle to the corresponding blood vessel, either the aorta through the aortic valve from the left ventricle, or through the pulmonary valve from the right ventricle to the pulmonary artery through the pulmonary valve.
Mm-hmm.
So when the left ventricle contracts, it pushes its blood through the aortic valve to the aorta.
Yes.
This gush of blood from the left ventricle to the aorta, inducing rapid rising of the tension inside the aorta.
Yes.
This is corresponding to the upper figure which is present in the blood pressure measuring, which is known as the systolic blood pressure.
Yes, because when somebody gets to measure his blood pressure, they say it's something over something, either 120 over 90 or whatever.
True.
So this is the higher, or
this
upper.
is the upper.
Yes.
Yeah, this is the upper. This is corresponding to the power of pushing the blood from the left ventricle through the aortic valve to the aorta.
Yes.
Then what happened after that? After that, the left ventricle relaxed and the blood pressure began to decrease inside the aorta, up to the extent that inducing closure of the aortic valve.
Yes.
So how blood can be transmitted from this aorta to the peripheral circulation to supply each part of the body?
Yes.
This is happened through what is known as the elastic recoil of the blood vessels. When the ventricle pushing the blood inside the aorta, the vessel will gain this energy coming from the left ventricle. Then after closure of the aortic valve, the blood vessels begin to lose this energy.
Yes.
What is known as the elastic recoil. This elastic recoil inducing pushing of the blood to make the blood moves forward to reach to the different part of the circulation.
Yes.
So this blood is very important because it transports the nutrition and oxygen to all parts of the body. So we have to be sure that this blood reaching to every part of the body.
Yes.
This elastic recoil inducing a lower pressure, which is represented by the lower blood pressure, or what is known as the diastolic blood pressure.
Yes.
So we have 2 numbers, the upper number and lower number. The upper number representing the systolic blood pressure, and it goes with the left ventricular contraction.
Yes.
And a lower number which is representing the elastic recoil of the blood pressure, and it is known as the diastolic blood pressure.
Okay, so
this is simply what is meant by blood pressure.
Yes. So when you have somebody measuring the blood pressure, the normal values that should be expected for the upper or the systolic and the lower or the diastolic, how much would they be
Yeah,
normally?
this is a very good question, because this is the numbers which is worldwide unified. If
Yes.
we are speaking about the blood pressure, you have to know that blood pressure is measured and recommended to be around 120 over 80,
Mhm.
up to 129 over 84. This
Yes.
is a very precise number, I know, but this number is very important, because above this number the patients become to be, or any person of us, any individual should be care of a blood pressure. If it is more than 129 over 84, he should be cautious and he should ask for medical advice, because he have to take care and take some measures to be sure that his blood pressure doesn't elevate more than that, because after these numbers the blood pressure become abnormal, and he have to take care and take some measures, either non-pharmacological or pharmacological, to have his blood pressure within the normal range.
So afterwards, I mean, beyond these figures, do we start to call it hypertension, or how do you call, or how do you define the hypertension?
Yeah, okay. There is actually there is a gray zone between normal blood pressure and elevated blood pressure. This
Mhm.
is the gray zone is between, as I said, between 120 to up to 129, and between 80 and 84. This
Yes.
is the gray zone, or what we know as the borderline blood pressure.
Mhm.
This is a red line here. To take care that above this you have to take care. Above these figures, you should know that you have hypertension,
Yes.
or you have an elevated blood pressure. You may have elevation in the upper number only, and this is known as the systolic blood pressure or systolic hypertension, and you may have elevation of both numbers.
Yes.
These two numbers is the systolic and diastolic, and here we are named as mixed blood pressure.
So somebody should suspect that he has or she has hypertension.
Yeah.
When does that happen? Or when do I suspect that I do have hypertension?
Yeah, this question is very critical, because most of patients with hypertension are asymptomatic. There is no
Asymptomatic,
symptoms, no symptoms at all to hypertension, and
Yes.
that's why we term it as a silent killer, because it kills silence. Without any symptoms, without any manifestations. We are the patient or the individual who have symptoms with hypertension, I told him you are lucky, because these symptoms is alarming, that you have an
Yes,
abnormal
at
elevated
least they
blood
know they do
pressure.
have it.
Yeah, but actually speaking, unfortunately, around 90 to 95% of patients with hypertension has no symptoms at all, and they discovered accidentally during routine investigations or routine examinations or before surgery or something like this, that he has an elevated blood pressure. So everyone above the age of 40, I think he has to be cautious, and he has to measure his blood pressure for at least once per year or once every 3 or 4 months, is to be sure that his blood pressure is normal.
Okay. So are there types of hypertension, or it's just hypertension?
Yeah, actually there is 2 types of hypertension. Systolic, yeah, primary hypertension, which is known as primary because up till now there is no, it's of unknown etiology. We don't know what is the reason of this elevation of the blood pressure. And actually this represents the majority of patients, around 90 to 92% of patients with hypertension of primary cause. We search for a cause for this hypertension, and at the end of the story, we search nothing, we reach nothing, and at this time we term it as a primary hypertension. There is another type of hypertension, which is the secondary hypertension, which means that it is secondary to something, secondary to another disease. Something like abnormality in the thyroid glands with hyperthyroidism or hypothyroidism, both of them inducing elevation of the blood pressure, abnormality or malignancy in the suprarenal glands, something like this. There is some congenital anomalies with which hypertension is present, like what is known as the coarctation of the aorta, or there is a constriction in the aorta, making elevation of the blood pressure in the upper limbs with normal blood pressure in the lower limbs. So there is multiple causes. This patient with secondary hypertension is actually lucky, because when you treat these underlying diseases, the blood pressure more or less become normal.
All right, so are there some people who are more prone to get hypertension than others?
Yeah, patient with other disease like diabetes, patient who smokes, patients who, or individuals, let us say, with a sedentary lifestyle, he didn't do any exercise. All these patients are susceptible for having hypertension. Also, there is some food behavior with which hypertension is more prone. If you have a high salt intake in your diet, or you have increased fat in diet, all of these are associated with increased instance and risk of developing hypertension.
Mm-hmm. Is there something like, sometimes you hear, my father got hypertension, my mother has some hypertension,
Yeah.
or sometimes the whole family has hypertension. Is there some genetic or some familiar tendency?
Yeah, there is
hypertension?
actually there is in the primary form, which we don't know why these patients have this hypertension. Most of them have an underlying genetic abnormality that is associated with the development of hypertension. Actually, there is a lot of theories speak about this, but up till now, this genetic is proved to be present and to have a role in the inducing of hypertension, but there is no rule how much it can induce, who can develop and who will not develop. Something like this up till now, it's not it's still under research.
But definitely, if you have somebody in the family or more than one person in the family having hypertension,
You should take care.
You should take care and
Yeah.
should be looking for
Yeah,
it in yourself.
yeah.
So, if I know that I have hypertension, or suspect that I have hypertension, the question is, when should I direct myself or go ahead to the doctor? I would ask you to answer this question just after the short break that we have. Brothers and sisters, we have a short break and we'll be coming back to talk more about hypertension, so don't go away. Until then, assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, assalamu alaikum, and we're back and we're still talking about hypertension. With us today is Dr. Ahmed Abdul Salam, consultant and professor of cardiology at Ain Shams University in Cairo, Egypt. And we were talking about the hypertension, and if I suspect or if I know that I have hypertension, should I immediately go to the doctor, or when should I decide to go to the doctor?
Sure. Once you are suspected even that you have hypertension, you have to seek medical advice, because as I said before, hypertension is a chronic disease, and you have to know that if you have any elevation in the blood pressure, you should monitor it regularly, and you should seek medical advice to see how the problem is and how to solve it.
Yes, so if I come to your clinic with hypertension or suspecting hypertension, what do you usually do for your patients?
At first, I have to check that you are surely hypertensive. This is done by measuring the blood pressure several times, at least 3 times with 2 weeks apart from each other.
Mm-hmm.
And you should measure the blood pressure in different time, day and night, and to be sure that it is elevated all through or not.
Mm-hmm.
After which you have to calculate what is known as the risk factors that include other conditions like diabetes, smoking, sedentary lifestyle, which I spoke about it before.
Yes.
If there is a family history of hypertension, something like this. After calculation of these risk factors, we are sure that your blood pressure is elevated. At this point, you have to take a decision. Either you will begin with a pharmacological treatment, or you have just to have what is known as lifestyle modification.
So somebody would ask you, if I have hypertension, so what would happen to me? Okay.
A lot. Actually,
A lot.
hypertension is a systemic disease, which means that when you maintain your blood pressure elevated for a long time, this will induce an abnormality on almost all organs of the body, which is known as the target organ affection or the target organ damage.
Mm-hmm.
Actually, you have a video here that may show that how much it is affecting the heart.
Mm.
It may affecting the blood vessels of the coronary that's supplying the heart. It may affecting the myocardium itself, making
The myocardium is the muscle of the heart.
yeah,
Yes.
make it hypertrophied, which may end by what's known as heart failure. Also, it may induce atherosclerosis, which if extended so much, it may inducing what is known as the myocardial infarction. Also, it may affecting the kidneys, the renal tubules here. It can appear here and may cause also infarction, which may end by renal failure, and the patient may need dialysis. Also, it may affecting the retinal blood vessels, which is the blood vessels of the eye, or may affecting the blood vessels that supplying the brain and inducing also infarction in the brain. All these are complications that may happen with
hypertension.
Neglected hypertension. Yeah.
So the hypertension or the raised blood pressure puts a burden on the systems, starting from the heart and the other systems, because
all
of
systems.
the pressure that the vessels are designed to carry or to take certain amount of pressure, and you raise this amount of pressure.
True.
So this takes me to a common question, which many people would ask about measuring blood pressure, because there are many devices in the market to measure the blood pressure. The newly ones, the digital ones, and the old classic ones, which work with the mercury. Sometimes you hear, no, the new ones are still not very accurate. You have to stick to the older ones to get the better readings. So which is better now?
Actually, the mercury sphygmomanometer, or the blood pressure instrument that using mercury nowadays is declining, because it is a little bit sophisticated. You have to know how to hear. You have to use a stethoscope, something like this. All these are maneuvers which is not easy to be done by everyone in the streets. So it is better, or what's coming up is the digital forms of sphygmomanometers, in which there is an automatic measurements of the blood pressure through an automatic machines, and you have just to know the instructions how to use it, and then if you use it in the right way, you will have a right blood pressure measures. And this instrument should be calibrated every now and then to be sure that these readings are normal. You ask me about which is better, the blood pressure monitoring inside the clinic or at home. Actually speaking, there is a lot of works speak about these conditions, but this is a picture that shows the digital form of sphygmomanometers. We have other picture that shows these mercury types of sphygmomanometer. As we see here, it is a little bit sophisticated. You have to use it, and you have to use a stethoscope with it to measure the blood pressure. I think it's not an easy way to measure the blood pressure. I think the digital form is easier. About measuring the blood pressure, actually there is you have to measure the blood pressure, sure, in the clinic, but what is more important is to measure the blood pressure at home, because some people, when they go to the doctor and see the white coat, they become anxious, and by this the blood pressure is elevated. Just from being scared from the doctor. They are scared from having a high blood pressure, so the blood pressure is elevated. This is known as a white coat hypertension. This is its name. So it's better not only to measure the blood pressure in the clinic, it is better also to measure the blood pressure at home, which may be more realistic than measuring the blood pressure in the clinic. There is another form of measuring the blood pressure, which is known as the 24-hour blood pressure monitoring, through an instrument which is used to measure the blood pressure all through the day. This type of measuring the blood pressure, we use it when we want to follow up a patient to know if this medication is enough for him to have his blood pressure normal, or we have to alternate these medications. Yes. So I'm sure that people would want to avoid having hypertension. But unfortunately, this is not feasible for everybody. But if we start by trying to decrease the risk of getting hypertension, how do we do that? We should do, all of us, we should have what is known as lifestyle modifications. You have to take care of your salt, you have to take care of your weight, you have to take care of your sleeping hours. All these are very important. To take care not to take much caffeine in tea, coffee, Nescafe, something like this. You should to decrease the stressful situation in which you are faced. You have to do some exercise, which is very, very, very important. Exercise is very important, because by this maneuver, around walking for around 1 hour a day for at least 5 days per week, this will allow you to have more or less controlled blood pressure. This is the first line of treatment, even in patients with hypertension. They have to do these non-pharmacological maneuvers, because it may may alone control the blood pressure.
You mean it could be successful that
Yeah.
just having the modification of your life
Yeah.
without taking any medication for many people?
Not in all
can work.
patients. We can
Yes.
say patient with mild elevation in the blood pressure, if he control his weight, if he do some exercise, if he stop smoking, if he control the salt and diet, all of this, if he do it, more or less his blood pressure may be in the normal zone and may need no medication to take.
Yes. So when we come to medication, of course, if you know somebody or our viewers know somebody with hypertension, they know that they have to take medications for life. Is
Yeah.
that true?
Yeah, it's true.
They have to take medications for life.
Of course, yes.
And
This is why I told you that we have to be sure that you are hypertensive.
yes.
Because once you are hypertensive, you should stick to the medication. Otherwise, you will have the complication which we already spoke about.
Yes. So, of course, we don't want to go into the details of the medication, but what usually do the medication do, and how much medication would a person need, and would I need more medication as my age goes on or my hypertension goes on?
A very difficult question because it's really differ from one person to another. What I mean, the medication which I use to control my blood pressure, if you use it, it may inducing hypotension, or you may inducing no effect at all, and you have to change it.
Yes.
Actually, there is also a very large numbers of members and families of medications which is used for treatment of hypertension. Through these medications, by alternation or mixing both or three groups, the blood pressure is controlled. No matter which type, in certain situations like diabetes, we prefer something, in others, in old age, we prefer others. Anyway, there is a combination of medications. We use it according to the international recommendations. By this combination of medications, we have a target that we have a blood pressure control, that's to say below 130/80. It doesn't matter which type of medication you use, but at the end of the story, we are speaking about a normal blood pressure figures, which is 130/80 or less.
Yes. So the aim is to maintain a normal blood pressure, but sometimes people would take 1, 2, or 3, or even 4 medications,
Yeah.
and it doesn't work with them. So is there a solution for these?
Yeah, actually, recently we have a solution for these patients with what we know as a refractory hypertension. That is hypertension which is not controlled by medications, and the patients have a high blood pressure all through, in spite of using a lot of medications.
Exactly, yes.
This is an interventional form of treatment of hypertension. Up till now, it is restricted to those patients with uncontrolled in spite of having more than one medications. It is done through a radiofrequency ablation to one of the arteries that supply, or both arteries that supplying the kidneys, which is known as the renal arteries.
Yes.
Through ablation of this sympathetic or the nervous plexus around the renal arteries, the patient get their blood pressure more or less controlled with medication also.
Yes. With ablation, what do you mean with ablation?
We
Do you have to do surgery, or how do you do
no.
it?
This is an interventional form. It's not a surgery at all. It's through a catheter
Yes.
that pass from a femoral artery through a snip or incision inside in the groin region. Then we enter a catheter, which is a small plastic tubes that pass through the aorta, which is a large artery from which it enters the renal arteries.
Yes.
And through this catheter, we do a heating of the wall of the renal arteries to damage this nervous plexus, which is responsible actually for inducing hypertension. When you damage this plexus with these nerves with the heat induced by this catheter, the damage of this nerve plexus inducing more or less normalization or making the blood pressure controlled,
And
or
then
at
going
least
back,
responding to medication.
Yes, and then going back to medication.
Yeah, of course, yes.
Yeah.
Or at least up till now, it is you have to be on medication.
Yes, of course. Dr. Ahmed Abdel Salam, thank you very much for being here with us. I'm
Thank
sure
you.
our viewers have benefited from the information.
I hope
we
so.
have. I'm sorry.
Thank you.
Brothers and sisters, I hope you benefited from the episode today, and I hope that everybody who suspects that he has or might have hypertension should go directly to the doctor and seek some advice. Inshallah, I hope that everybody would, even those who have hypertension, would be able to control it at the early stages. We've come to the end of our episode today, so please keep writing to us on our email. Our email is health@huda.tv, and of course our website is huda.tv. And our Facebook is health.huda.tv on the Facebook, so please write to us and ask us your questions, inshallah. Until next episode, I wish that everybody is happy and healthy, inshallah. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.